Motherhood is often disguised as a beautiful journey, and indeed it is. Let's talk about infant health and how to take care of a baby from day one up to 5 years when a baby can move, even go to school. There is a lot that happens in this period. Let us find out with Nurse Philip of Kiraini Mission Hospital. A good evening, and thank you so much for making time for yet another episode of the Medi Camp. Today we are going to be learning about infant health as promised in the previous episode. So it has been a long 9 months and our baby is right here with us. So what happens after the baby is born? Let us find out with Nurse Philip, who is going to be taking us through this episode. Karibu sana, and thank you so much for making time for us. Introduce yourself through that camera. Tell the viewer who you are and where you're from.
Good evening. My name is Philip. I'm a nurse working at Kiraini Mission Hospital. As you have heard, today we are going to talk about child health. That was we call child welfare clinic, and we are going to learn a lot about a baby and an infant. Welcome.
Thank you so much. So Philip, what exactly happens after a baby is born? What is the first thing that happens?
Now we assume that the baby has born and the baby is normal. So the first thing that as a medical and as a nurse or a midwife you do, you first weigh the baby. We need to know how many kilograms the baby is. Now this happens after you have examined the baby and you have seen the baby is well and the baby is normal, the baby is healthy. So you have to weigh the baby and see how many kgs the baby is. Then from there you have to see to keep the baby warm. So we use a warm environment. The baby has to be born in a warm environment. So we keep the baby warm. In some hospital settings, they will clothe the baby. Watavalisha mtoto nguo. Then they will wrap up the baby to keep the baby warm. So those are the first interventions that we take, immediate interventions. There are other interventions that are going to take place because we are going to give some drugs to the baby. I can call them some drugs. These drugs include vitamin K. It includes tetracycline eye anointment. These are a drug or kind of a liquid that an anointment that we give the eyes of the baby, and then later we are going to do immunization. So those are some of the interventions that are taken when the baby is born.
Even before we weigh the baby, when you're examining the baby, what exactly are you looking at about the baby?
So when you're examining the baby, we are basically looking at the well of the baby. One, we want to see if the baby is breathing and breathing without any help, what we call spontaneous breathing. Then we need to see that this baby is, the movement of the lips is okay. So we need to see that the baby has good movements. Then we need to see the physical examination of the baby. The physical examination of the baby is checking if the baby has something like we call extra digits. Kidole ingine imejiongeza. So we check on that. We check if the baby has all the organs are formed. Those are the first examination that we check on the baby. And maybe I might have forgotten that we check on, we cut the cord. We make sure that we cut the cord of the baby is born. When you have ensured that the baby is alive, then you cut the cord to ensure to start examining the baby.
At what point do we spank the baby to make sure that they cry?
Basically, the baby is supposed to cry, if we can use that word, on their own. Immediately the baby is born, there is that first cry, which first cry makes, that first cry is very essential or very important because it makes the baby pull oxygen to their lungs. And then the oxygen, the lungs will expand, and then the baby is ready to breathe on their own. If the baby does not cry, then you can stimulate. That's the right word to use. You can stimulate the baby to start breathing on their own. What we stimulate is that cry. But you don't need to be rough on the baby. You just be gentle on the baby and tender. Yes.
So once we weigh the baby, what is the right weight for a newborn baby?
We say that the right weight for the newborn baby is any weight from 2.5 is the right weight. That's a mature baby. Any weight from 2.5 is the right weight. Yes.
Up to what point?
There's no point that we say that this baby is not well. But remember, There are those babies who are born big babies. There are babies that are 4 kg plus. Kwenda juu, those are big babies. But the baby can be a big baby, but the baby is well, the baby is healthy. So being a big baby does not determine that the baby is not healthy or not healthy. The baby will be born at that kg, but be healthy and be normal.
And for those that are below 2.5, we call them underweight babies.
Yes.
Are they healthy? Is there something that is done immediately after you realize that this baby doesn't have the right weight that is expected of them upon birth?
Yes, if a baby is born below 2.5, that's an underweight baby. Some of them are born to below 2.5 because they are premature. So there are those interventions that you should take on the baby. One of them is this warmth. Joto kwa mtoto is very essential. So you have, first of all, you have to examine the baby and see that this baby is mature and this baby is okay. And this baby, even if they are below 2.5, can they live on their own? So if we have, after you have examined and seen that this baby can live on their own, now that's when now you give the baby to the mother and the rest of the intervention can take. Now, if the baby is not able to breathe on, to live on their own, there are those interventions that you take. There are those baby who are taken to nursery. There are those baby who we do something we call Kagaru mother care. Kagaru mother care is when we put mother and the baby skin to skin, so that the baby can pull that warmth of the mother, which helps them even get warmth, because warmth is very paramount for the baby to be born. So after the health professional has examined the baby, and then they will determine if this baby needs those interventions or the baby is okay.
Other than a baby being underweight, do we have other reasons that could make a baby be taken to nursery?
Yes, there are other complications that can make the baby be taken to nursery. A baby can be born mature. A baby can be born on the right weight at the right time, or a term baby, but the baby has other complications. Maybe the baby did not breathe immediately they were born. So we take that baby to nursery. Then what we call a premature baby, we can take that baby to nursery. There are those complications like jaundice. Jaundice is yellowness of the baby. Nasikia mama anasema mtoto wangu wako yellow. That baby is taken to nursery. Those are some of the complications. Another complication is the baby, we say that the baby does not breathe on their own. So even after stimulating the baby still cannot breathe on their own. So we take this baby to nursery so that they can be managed from there.
Okay. And how soon after the baby has been born, how soon can they be breastfed for the first time?
After the baby has been born, the baby has been examined and the baby is okay, breastfeeding should start within the first 1 hour after birth. So within the first 1 hour, we want to start breastfeeding this baby. Yes.
And there are cases where, for some reason, which you're going to give us what could be some of the reasons, where a mother cannot breastfeed.
Yes, there are some of reasons why a mother cannot breastfeed. Some of them are medical issues. Some of them is for the mother herself. When the mother was going through let's say chemotherapy or radiotherapy, we sometimes don't advise that mother to breastfeed.
For cancer patients?
Yes, for cancer patients or any other reason when they are undergoing those therapy. So we advise that mother not to breastfeed. There are those mothers who are born and they give birth, and then the mother is not okay health-wise. Some of them go to what we call psychosis. So yes, the baby will breastfeed, but we have to take care of this baby because the mother sometimes may not be attached to the baby. That social attachment. Ni kama mama hataki mtoto. So that's another reason that can make the mother not to breastfeed. Yes.
And are there chances that a woman gives birth and then they cannot produce milk for the baby?
There are those chances, though rare. Some of the reasons why the mother cannot breastfeed the baby, breastfeeding, we say that it comes, it has, we use 3M. It is about the mother, the baby, and then the breast. So if the mother is not ready to breastfeed from mentally, if the mother is not ready to breastfeed, then the milk letdown will be minimal. Another reason is if they don't do good attachment to the baby, so the production of the milk will not be normal. Some of them have hormonal reasons, hormone imbalance. That time, the mother will not be able to breastfeed well. So those are some of the reasons that can make the mother not breastfeed well.
What about for women with HIV? Let's talk about HIV. For women with HIV, can they breastfeed their babies?
Yes, this one I want to say that a HIV positive mother can breastfeed their baby. Only that they have to breastfeed this baby under the care of a healthcare professional. They have to walk this journey with a healthcare professional, because remember, this mother has to be on treatment for ARVs. And then the baby, immediately the baby is born, there is a prophylaxis ama dawa tunaanza kupatia mtoto ambazo zinazuia mtoto asipate virusi, sababu virusi, sometimes the breast milk has this virus, HIV virus. So there is that prophylaxis ama dawa ambazo mtoto anatumia ndio wakati ananyonyesha asiweze kupata virusi kutoka kwa mama. So a mother with HIV positive has no contraindication, ama hakuna kitu kinamzuia yeye kunyonya. They can still continue breastfeeding like any other normal mother.
Yeah, and so for now a mom that has undergone chemo or radiotherapy, you said that you would advise them not to breastfeed the child, or for some reason maybe the mom didn't make it through the whole process, and this kid, what exactly happens? What are the alternatives to breastfeeding?
There are other alternatives to breast milk, and one of them, and the one that we use, is we prescribe a formula for this kid or for this infant. And this formula, you as a mother or the caregiver, you said that the mother maybe did not make it. So this baby will be under a caregiver. So this caregiver will work with the healthcare profession so that they can prescribe this formula, the right amount, the right preparation, all that, so that the baby can grow well. So we use formulas in case of this. Yes.
And for mostly mothers are advised to breastfeed their children for 6 months without feeding them on anything else. Why so, and what are the benefits?
The reason why we say that babies should breastfeed for the first 6 months is because, one, breastfeed milk is very important for the growth of the baby. The breast milk has a lot of nutrients and a lot of hormones and a lot of antibodies, that are very essential for the baby and for the growth of the baby. So we say that breast milk is very important for the development of this baby. Remember, when the baby is born, some of the organs are not mature. So we prescribe that this baby should breastfeed for the first 6 months. Another reason is because, as I said, the organs of this baby are not yet mature. The digestive system, ile njia ya chakula haijakomaa. So the baby should not start feeding on any other thing, because the digestive system only works on the milk. So before we introduce even other feeds, we first have to breastfeed this baby until the organs are mature for the digestion to take place of other foods. Yes.
And for a kid that's relying on formula, they're also going to feed on that for 6 months.
Yes, a kid who is relying on formula, they are still going to work to take this formula as they are taking breast milk. So the formula, the amount is added as the baby grows, and the baby adds weight as the baby grows, and as the months goes, the formula is added. But taking this formula is going to take place as a breastfeeding baby. Yes.
And even as much as parents have been told, or new moms have been told to breastfeed their babies for 6 months, we still have mothers who feed their kids earlier, before the lapse of the 6 months. What are some of the risks? Is this going to affect the health of the baby in any way? What are some of the risks?
Yes, it can affect the health of the baby, because remember what I said earlier is that the digestive system of this baby has not yet matured. So you are introducing something that the digestive system cannot, let me use the word manufacture, or cannot process. So when you give this baby the complementary feeding or other foods, then you're making this baby, the baby can sometimes have constipation because the baby is not yet mature. Then the development of the baby will not work as it should be, or will not go as it should be. The baby will come for clinics, and then you see that the weight gain and the height is not as it should be, because the baby started feeding on other feeds before the time was the lapse of 6 months. Yes.
Now that is some important information that I believe is mostly going to reach to a mom who gave birth at a health facility. But still, we have women giving birth back at home. What would you advise them?
A mother who gives birth at home. We advise mothers to give birth at hospital or health facility. Now, a mother can give birth at home for some reasons, but what we advise is immediately the baby is born, you visit a hospital, a health facility that is near you. Then from there, as we had talked earlier, the examination that were done to a baby who was born at the health facility will continue. The medication that is given will continue. The baby will be weighed. And if there's other complication to the baby and the mother, then the interventions will take place.
That is it to a newly born baby. Let's talk about immunization in our next segment. Stay tuned.
The Aberdare Technical College ATC ni marakumenyithia ati Intex ni irathie na mbere ukegwatira artisan certificate kana diploma kothi-inĩ ici tau. Thĩinĩ wa School of Hospitality urathomera kothi ta Food and Beverages Production and Service, Catering and Accommodation Operations na Baking and Pastry Skills. Thĩinĩ wa School of Hairdressing and Beauty urathomera Hairdressing and Beauty Therapy na Barbering and Massage. School of Media Technology ugathomera Photography and Videography, Corporate Live Streaming na Drone Operation Skills. School of Electrical Engineering ugathomera Electrical Installation na Solar PV Installation. School of Water Engineering Technology ugathomera Water Engineering Technology na Plumbing and Water Services. School of ICT ugathomera Diploma in Information Technology, International Driving License neo ICDL, Computer Repairs and Maintenance na Computer Packages. Kwina hostels na no maragwethera attachment mari mita 300 kuma Karati na tauni, barabara-inĩ ya Kati na guthie Nairobi, na no mahurire thimu namba 0726 507444. The Aberdare Technical College ATC, turning learners to entrepreneurs.
We are putting certainty in their future so you can have a peaceful life. Exploring emerging opportunities so you can explore life. Covering your health so you can share your well-being with others. Taking care of your investments so you can enjoy the fruits of your wise decisions. With Britam, we are assured of over 55 years experience in life insurance, health insurance, general insurance, investments, and retirement solutions. Britam, with you every step of the way.
Thukuru wa The Nyeri National Polytechnic nĩ makoretwo gĩthomo kĩa Recognition of Prior Learning RPL we ono heguru kothi-inĩ ta ũthondeki wa thimũ, gypsum fixing, fundi wa mahiga nĩo masonry, waki wa rangi, plumbing, wĩkĩri wa tiles, cosmetology, fashion design, ũmakanika, gũcinĩrĩra, motor vehicle electronics. Kĩrĩa ũrabatara no kore neti rutaga wĩra ũyũ ta kũrema mawĩra maku, tabarĩri wambĩkĩte, wonani wa marĩhi makinyanĩirio. Andũ a gũthũrima wĩra ũyũ nĩ The Nyeri National Polytechnic. Nĩgũkũiyũkia kanya gaka wĩyandĩkithie kũgerera email itũ nĩyo application@thenyeripoly.ac.ke kana rpl@thenyeripoly.ac.ke kana ũtware kũgũra thimũ namba 0716 795 634. Mwaka ũyũ wa RPL ũhingũrirwo andũ othe.
Welcome back to our second segment. We're going to be talking about immunization. What is immunization, Philip?
Immunization is what we can call protecting your baby against diseases. We give a vaccine or we immunize your child against some of the diseases that the baby gets when they are little. Yes.
And so when a new mom is going to clinic, purposely they come for these immunizations.
Yes.
How soon do we start to administer this immunization?
Immunization starts when the baby is born, because you have those immunizations that are given immediately the baby is born, and then there are those immunizations that are given as the baby grows. So immunization starts from when the baby is born at maternity. Yes.
So for a baby's immunization, I understand it's not one. It's going to take a long time, like up to 18 months. What are these immunizations? What are they preventing? And at what stage are they administered?
Immunization starts immediately the baby is born at maternity. That's when we give our first immunization. That is BCG and or polio. BCG is given. I believe that all of us have that mark. We know where it's given. This vaccine or this immunization is done and given to prevent TB. Then we have polio. Polio is given oral, ama kwa mdomo. This one prevents poliomyelitis, ugonjwa wa kupooza. Then we at 6 weeks, that's when the mother will be given another date to come for the clinic. Then here we give several vaccines. We give oral polio again, that is inazuia ugonjwa wa kupooza. Then we give pentavalent. Pentavalent has several diseases that it prevents. One of them being whooping cough, pertussis, hepatitis B, some pneumonias. Those are some of the diseases that it prevents. Then we are going to give another injection, that is pneumococcal. It prevents some meningitis. It prevents some various diseases and pneumococcal. It also prevents some kinds of pneumonia. That's what we are going to give at 6 weeks. So we say that 6 weeks we are going to give polio, we are going to give pentavalent, we are going to give PCV or pneumococcal. We are also going to give rotavirus. Rotavirus is given because it prevents what we call ugonjwa wa kuendesha. It prevents certain kind of diarrhea that is brought about by a virus called rotavirus. That's why that vaccine is called rotavirus. After that, we are going to give another TCA or another date to come for clinic. That is at 10 weeks. At 10 weeks, we are going to repeat these vaccines again. Then we are going to give the mother another date to come for clinic. This will be 14 weeks. At 14 weeks, this mother comes, and apart from the normal vaccine that we give at 6 and 10 weeks, that is oral polio, pentavalent, pneumococcal, and rotavirus, we are going to add another vaccine that is called that is a vaccine that prevents polio. So we are going to boost the polio that we give oral, ama kwa mdomo. We are going to boost it with another vaccine that is called IPV. It also prevents polio, but it's an injection. That now we have finished the first segment of immunization. Then from there, the baby will come for weight and height monitoring from 14 weeks. At 6 months, from 14 weeks at 6 months, we are going to give another vaccine, an oral vaccine, that is vitamin A. Vitamin A gives baby immunity, so it prevents any disease that may come. It gives immunity. From 14 weeks, the mother is given another date to come for clinic. That is 6 months. But before 6 months, we do weight and height monitoring. Now at 6 months, we give a supplement. That is vitamin A. That is given oral. It boosts the immunity of the baby. Then from there, at 1 year, we are going to give another vitamin A supplement. That's going to add another immunity. Then from there, it's 18 months. That is 1 year and a half. At 1 year and a half, we are going to give vitamin A supplement, and then we are going to give, after the baby receives the vaccines up to 14 weeks, then we give another date to come for clinic. That will be 6 months. At 6 months, we are going to give a vitamin A supplement that will boost the immunity of the baby. Then from there, at 9 months, we are going to give another vaccine that is called measles rubella. It is a vaccine that against measles and rubella. Then from there, we are going to give another clinic at 1 year. We are going to give a vitamin supplement again, vitamin A supplement again. Then at 1 year and a half, 18 months, we are going to see the baby again and give a booster of measles and rubella. And then we are going to give again vitamin A supplement. From here, the baby is going to receive vitamin A supplement and deworming. The deworming starts at 1 year. It goes again at 1 year and a half. Then after there, the baby is going to receive this deworming and vitamin A supplement every 6 months up to the time the baby reaches 5 years. Yes.
It sounds like quite a long process, but sure. I believe all mothers should follow that for their babies, because if not so, there are going to be some consequences, right?
Sure.
Mm-hmm. What are some of the consequences? What are some of the things that could happen to the baby as a result of maybe they skipped an immunization at one point or another?
We have an obvious consequence of not receiving this vaccine. On it being that the baby will get the disease that he or she should have been vaccinated against. So in case of an outbreak of a disease, let's assume measles, and the baby was not immunized against the measles, then this baby is going to get that measles, or is likely to get these measles compared to a baby who received a vaccine against this disease.
So for your baby, let's talk about taking care of this infant. What are the favorable sleeping positions, and how should mom or just anyone handle this baby? What are the best positions that are not going to risk this baby's health in one way or another?
We basically don't have that position or that prescribed position that the baby should have, but we advise mothers to let their baby sleep on the side. Reason being that the baby, immediately the baby is breastfed, sometimes there's that milk that they breastfed being excess. So the milk will come out on their own when the baby is sleeping. So when the baby sleeps on their back, the baby is likely to choke. But when the baby sleeps on their side, then this excess milk, when it comes out, then it will just fall on the bed and the baby will be safe. Yes.
And after 6 months of breastfeeding, what would you advise parents to feed on these kids? What is the advised diet for a baby after 6 months, when now it's okay to breastfeed and at the same time feed them on other foods?
I would like to start it by saying that at this clinic, the clinic for the child welfare clinic, we work hand in hand with the nutrition department. The nutrition department ni ile department ya chakula, what they can call it. So we work hand in hand with them. So it's that important for a mother to bring their baby at 6 months, so that they can be given advice on what to do to feed. Because some of the mothers start feeding and they feed from whatever meats they have had, or the wrong feeding, the wrong quantity. Because when the baby reaches 6 months, all this should start being fed. You should start feeding the baby on the locally available feeds, and then after that, the baby will start with the locally available food. We advise mothers not to feed the babies on chakula ile nyepesi sana, ile kama maji. The food should be thick, so you should feed your baby on some thick food, it being marenge, waru, dizi, uji. Those are some of the feeds that they start. But let your feeds be a balanced diet. You can add on that food. Don't feed your baby on carbohydrates only. start on protein including cereals, then vitamins including fruits and then greens. So breastfeed your baby on all this, but we advise mothers not to start feeding their babies on animal protein. Animal protein being meat, milk, and eggs. Don't start feeding your baby immediately at 6 months on animal protein. That one can wait. Maybe after the baby has started feeding, around 9 months or so, the baby can start now feeding on that animal protein. Yes.
Is it safe to give babies sodas after that period of time, after 6 months?
I would not advise mothers to give sodas. Let the baby feed on locally available food that is that's a balanced diet. You know, a soda is not a balanced diet, so we advise these mothers to give food that is a balanced diet. Yes, not those other funny foods. Yes, I can call them funny foods.
I realize we've talked much about breastfeeding. How exactly should it be done? Because for new moms can be a challenge.
Breastfeeding, yes, can be a challenge to new moms and to those mothers who have had kids. Breastfeeding is taught at the maternity. There is what we call right attachment, ama vinye mtoto anashika matiti. There is another one that we call proper position, vinye unafaa kushika mtoto. So what we advise the mothers is that they should have their baby lying skin to skin or abdomen to abdomen, tumbo ya mama na ya mtoto zilaliane. So it should be like that. That is the proper position. Alafu mtoto mama ashike mtoto vile inafaa. Then the other one is attachment. We advise mothers that the baby's mouth should cover at least the quarter of the black part of the breast. There is that black part of the breast, so 3/4 of that part should basically be inside the baby's mouth. That's the right breastfeeding position and the right breastfeeding attachment. Yes.
And for these breastfeeding mothers, what foods are they advised to take so that their breast milk does not dry up, or they can produce enough for the baby?
One of the things that I should talk about is that there are those mothers maids huko kwa vijiji that my mother should not feed on this, should not feed on that when they are breastfeeding. What I would like to say is that a mother can feed on whatever is locally found for them at the village, or what they can locally find. A balanced diet it's very essential for the mother because of milk production. Your meal or your plate should contain carbohydrates. It should contain proteins, should contain vitamins. There should be water. And there is this advice that we give to mothers. One of them is that a mother should wake up and feed on a plate of food. What normal people do is they wake up and feed on chai na mkate. That's not the right meal for a breastfeeding mother. A breastfeeding mother should start on a meal. Basically, it can be a meal that you left that you ate last night, and then it was left. Then you should take that meal. In between that morning, the breakfast and lunch, you should take a snack. Then you should take a lunch, a plate of lunch. That should be balanced diet. Then you should take another snack between lunch and supper. Then you should take your supper. Plus those meals, you should take another 2 extra meals. These 2 extra meals, we advise the mothers that should be at least half of what you take for lunch. 2 extra meals. When you take these meals, then that is enough for you. It's balanced, and you take it that way, then milk production will be okay, and your baby will breastfeed well.
Does the size of a mom's breast affect production of breast milk?
No, it does not affect. That does not affect at all. Your breast size does not affect. It's small, it's big, it's medium. Milk production will be normal. If you're taking the right diet, if you're ready to breastfeed, as I said earlier, and if the baby, you are putting the baby in the right position and right attachment, then the breast size does not matter.
Thank you so much for staying with us. That's it for this segment. We're going to be talking about complications that could be found in a newborn baby, how they are handled, and of course, motherhood is a lot. Could this affect a mother's mental health? Stay tuned for this and more.
Dunamis International Gospel Center presents Nairobi, Kenya Healing and Deliverance Crusade. Theme, the day of His power. Ministering live, Dr. Pastor Paul and Dr. Mrs. Becky Paul and Enche. Date, 16th to 17th of May 2024. Time, 5 p.m. daily. Venue, Kasarani Stadium, Nairobi. Come and experience salvation, healing, deliverance, miracles, signs, wonders, and the almightiness of God's power. Special feature includes Ministers Conference holding on Thursday the 16th and Friday the 17th of May 2024. Time 9 a.m. For inquiries call +254 7586 55045 or call +254 7577 66261. Invite everyone. Jesus.
Welcome back. We are going to be talking about complications in a newborn baby. So, Nurse Philip, what are some of the complications that could be found in a baby, in a small baby?
There are several complications that can be found in a baby. One of them being sepsis, another one being fever, another one the baby can stop breastfeeding or refuse to breastfeed. Another one the baby can be less active. There is what we call jaundice, yellowness. There is another one that we call, I have talked about fever. The baby is sometimes the baby is not breastfeeding well. So those are some of the complications of that can be seen in a baby. Yes.
You mentioned sepsis. What is that?
Sepsis is, we can call it basically in a layman language is infection. Yes.
And so, Nurse Philip, what are some of the complications that can occur in a newborn baby?
There are several complications that can occur in a newborn baby. One of them is refusal to breastfeed, infections, fever. The baby cannot be active. The baby can have jaundice, that is yellowness, and some of these complications can be prevented by the mother. We speak about jaundice or yellowness, ile yellowness wa mama anasema mtoto wangu ako na yellow. It can be prevented, and one way of preventing is proper breastfeeding. The baby should be breastfed as you are advised by a health professional. So that one way of preventing jaundice. Infection or sepsis, what we call sepsis, that one can be prevented by kuosha kitovu vizuri venye ulionyeshwa na daktari na kuweka ile dawa ulipatiwa na daktari. Also, your general cleanliness. When you're tending to your baby, make sure that you are clean. You clean your hands before tending to the baby. Even when the baby comes to a time of feeding themselves, make sure that the baby is feeding themselves, they are clean. The utensils that they are using are clean. Then this can be avoided. And we basically say that when you get this complication in your baby, just visit a health facility, tell your health profession, then interventions can be taken.
So you're saying that these milestones happen at a different age. At what point should this baby be sitting? At what point should they crawl? Yeah, so at what age should each milestone occur?
I can say that the milestones don't have that specific procedure that they should follow. One baby can start crawling before they can walk before even crawling. they can sit before even crawling. So if I break them down, I can say that at 3 months, the baby will be able to hold their neck. So ukishikilia mtoto ukimuinua juu na mkono yako, unaona anajaribu kushikilia shingo. That's at 3 months. At 6 months, the baby is sitting, maybe on their own or when they are supported. And at 6 months, the baby will be able to reach at those items that are around them. They try to reach at them. At 6 months, the baby will be able to follow objects at an angle of 360 with their eyes. Then at 9 months, this baby will be sitting on their own without support. At 9 months, baby will be crawling. At 9 months, this baby will be playing with toys. So you put a toy down, the baby will be playing with this toy. Then we go to 1 year. At 1 year, this baby will be standing on their own. Sometimes they can take 1 to 2 steps, then they fall, or they can walk under support. Then at 1 year, also the baby will be communicating. They will be communicating like they point at something that they want to be given. Some of them say the word mama, baba, dada. That's at 1 year. At 1 year and a half, the baby is walking on their own. The baby can be walking at, let's say, at stairs. They can take 1, 2 steps, but these steps, they take these steps at 2 legs. Not like a normal person. At 1 year and a half, the baby will be communicating. Will be saying, let's say, 10 to 20 words. At 2 years, the baby will be communicating very well. The baby will be walking on their own. The baby will be playing around. At from 2 years to 5 years now, the baby will be just playing on their own. Will be communicating very well. At 5 years, the baby is very well communicating. Remember, this is a school-going age, so the baby is playing around, communicating very well, and that's how we know that at this time. That's when we know that there is a delayed milestone. Yes.
Okay, and this looks like it's a lot. It's quite a journey, and this baby is working with the mom. Are there chances that taking care of a newborn baby up to maybe the 2 years, you're saying they can play around, they can talk, they can communicate? Are there chances it's going to take a toll on the mom's mental health?
Sometimes it can take the mom's mental health. One of them, mental health for a mother can start even after delivery. It can come anytime from delivery to the time the baby is 5 years going forward. And some of the mental health is the mother, there are those symptoms or signs that we can call. The mother refuses to breastfeed. Sometimes the mother feels that they are not hawajafika ku take care of this baby. Sometimes the mother feels like hanyonyeshi vizuri, mtoto hakui vizuri. The gaining of these milestones, the mother sees like there is a delayed milestone because of what they have had. So these are some of the mental health that can come to the mother. Some of them, these milestones can be have several causes. Some of the causes are if there's a history of mental health in the family. Another one is the bringing up of the family. You can imagine a mother who is a teen and they are pregnant, they have given birth. They are not accepted by the society. Maybe the mother is furious, the father is furious about her getting pregnant at the teenage. So that can also bring mental health to this mother. Another one is the mother does not have information on child growth, bringing up a baby. So when they don't bring up the baby as they expect, this is another thing, another reason that can bring about mental health.
So as we wind up, Nurse Philip, what's your parting shot? What do you want to say, and who do you want to say hi to?
First, I would like to say thank you to GTN TV for giving me this chance to share the knowledge that I have to your viewers. Secondly, I would like to say thank you to Kireini Mission for also giving me this chance. Then I would like to pass my greetings to my fellow colleagues at Kireini Mission, and then my parents back at home, and my friends. Yes.
Thank you so much for tuning in. A good evening. See you again on our next episode here at GTN TV, the home of gifts and talents. I am your host, Mumbi Mavuti. Remember every day that your health is your wealth.
For 8 exhilarating days, the hills and valleys of Nyeri County came alive with the vibrant energy of cultural expression. Welcome to Nyeri Cultural and Tourism Festival's auditions, a journey of talent and passion that spanned across all corners of the region. From the rhythmic beats of the traditional drumming to the graceful movement of indigenous dances, the audition celebrated a rich tapestry of Nyeri's cultural heritage. But the festivals didn't stop there. Contemporary dances groups dazzled the audiences with the innovative routines, blending the tradition with the modernity in mesmerizing displays of creativity. From the eloquent words of the young poets to the soul-stirring melodies of the local musicians, from the vivid strokes of the artist brushes to the theatrical brilliance of the aspiring actors, the auditions showcased a depth and the breadth of the talent within Nyeri's communities.